All right, as you guys know, Robert F. Kennedy Jr. was confirmed as our next Secretary of HHS. Congratulations to Mr. Kennedy. Job well done, and congratulations to President Trump for putting the pressure on the Senate to get that through. And congratulations to the people for letting people know that this is what we wanted, this is what we voted for. So anyway, with that in mind, right now, confidence in physicians is at an all-time low. Confidence in these regulatory agencies is at an all-time low. And these are some of the things I wrote notes, are some of the things that I would like to see happen. Hopefully RFK can do some of these things. I think anything less than sweeping reforms is not going to get the job done. So first of all, get rid of the TV ads. We are one of the few countries in the world that allows pharmaceutical advertising on TV. It corrupts the news organizations that would otherwise report on them because they're dependent upon those advertising dollars. We are, like I said, other than New Zealand, I think we're one of the only countries in the developed world that allows this. That practice needs to go away. The conflicts of interest that clearly are occurring at the FDA, at the CDC, at the USDA, and other agencies needs to go away. We should not have these agencies allowing for their agents to go work for pharma afterwards, and then vice versa the other way around. That creates a tremendous conflict of interest. The fact that we have pharmaceutical companies providing 65% of the funding for the drugs that the FDA is regulating also needs to go away. Liability shields on vaccines needs to go away. Hey, if they work and they're safe, we shouldn't need a liability shield, right? That's just the way it is for any other drug. That needs to happen as well. Shielding data from peer reviewers. When drug companies put out new drugs, we need full and complete transparency of all the data, not just what they want us to see, not just summaries of what they found. All raw data needs to be available for peer reviewers. Studies that are negative need to be put out there. You can't be hiding your data anymore under the guise of proprietary information, whatever it's done. It's clearly, we're not getting the full picture here. MedWatch. So when a drug is brought to market, there is supposed to be post-market surveillance that occurs. And this is right now voluntary. So what it results in is that someone would estimate that less than 1% of serious adverse outcomes are actually reported to this MedWatch system. That needs to be mandatory, likely for the first 5 years that a drug is on the market. That means if you show up in the ER with a drug side effect that puts you in the ER, mandatory reporting is required, right? So we can get an idea of how safe these drugs actually are, rather than waiting 10 years for enough people to die before we actually make changes to perhaps pull it from the market. On the food side, we got a lot of food ingredients here in the United States that are literally banned in other countries. We need to look into that, and if there's serious reasons why that is occurring, then we need to ban them in the United States too. It's just that simple. We don't need to be poisoning our Americans because of free market capitalism or whatever the excuses might be. Stop poisoning ourselves, stop poisoning our kids. Foods that are generally recognized as safe, that requirement needs to be improved. We got all these new ingredients on the market, and it didn't kill rats acutely, so we bring it on the market and call it generally recognized as safe. And now we have all these people with autoimmune diseases and cancers and so on and so forth. Quite honestly, we don't need any more new foods, to be honest. There's plenty of food. I mean, God gave us the foods we're supposed to eat. They're already there. We don't need to be inventing new foods, right? So this whole thing about bringing these new crazy ingredients on the market for the sake of cost or shelf stability or things like that needs to stop. On the physician side, look, physicians need to be incentivized. They need to be supported. They need to be given resources so that they can actually provide lifestyle-based medicine. It's so easy to prescribe drugs and procedures. Doing lifestyle stuff is hard. It takes a lot of work and effort and support. And right now, physicians are not only not incentivized, they're disincentivized to do that. They have no resources. This is why what our company at Rivero is doing is so unique, in that we're having to provide all that resource. That should be blanket across the board. Physicians need to be incentivized differently, right? Finally, studies on lifestyle. NIH, which has basically become a drug approval process. We need just as much money put into lifestyle treatments for diseases. I mean, I see it every day. Things like MS, psoriasis, rheumatoid arthritis, Crohn's disease, responding to lifestyle, and yet it is damn near impossible to get the money to study these things, right? That needs to change. We need to have money poured into these lifestyle treatments for disease. In my view, lifestyle is more important than drug treatment, and we need to understand how that works, right? All right, so these are some of the things I'd like to see happen. Hopefully RFK will, respond to some of this stuff or follow on those lines. I think he will, but I think these things need to happen. And again, we can't make America healthy again unless Americans want it. And so you guys listening to this video, you need to demand these things yourself, and you need to, take actions among yourselves and your own families to help it happen. The government's not going to fix it all for us, but there's some things they can do to get out of our way, and there's some things we can do with the government to stop allowing, the predatory practices to occur. All right, guys, let me know what you guys think. I'll be looking forward to your comments. What else might you add?